Very lucky that we've actually been joined by a consultant cardiologist. He actually happens to be heading the cardiology department in Maroof International Hospital as well. He's Dr. Omer Mufti. Hello, sir. Assalamu alaikum. Good morning. How are you?
Wa alaikum assalam. Thank you. I'm doing very well. Thank you for having me here today.
Sir, thank you very much for joining us. It's wonderful to have you over here. It's an honor for us, for somebody who actually happens to be a doctor, of the heart himself. And so you might be ruling a lot of hearts these days as well. Anyways, because I think one of the most common issues over here in Pakistan, number one, starting with cholesterol and then blood pressure and all of these illnesses, diabetes, and they kind of contribute to heart diseases, and may it be COVID as well, because I've had an example even in my household where somebody got COVID and then they ended up with atrial fibrillation as well. But that's not what we're talking about today. What we're talking about is those choices we need to make in life to make sure that our heart is healthier every single day and it's ready to love and spread love.
True. So, I mean, with this being the new year, people always come out with New Year's resolutions. And one of the typical ones that people always come out with is, I'm going to watch my diet, I'm going to exercise, I plan to lose 10, maybe 15 pounds, whatever, throughout the year. But no one really follows through with it. True. Now, the thing that we need to realize from the aspect of our own heart health is there's simple choices that you make every day. Your caloric intake, however much you take in for breakfast, for lunch, for dinner, needs to be lower per day, and your amount of exercise needs to be higher per day. So the amount of calories you expend is more than you intake. And if you do that, you will eventually lose weight. It'll be gradual, but that's much better than people who are doing these fad diets and everything else. But from our perspective, from the Southeast Asian culture and everything else, where we have a lot of, ghee, chiknai cheezein, hum khate hain, that actually causes a lot of cholesterol deposition in all the arteries, particularly then the heart, which can then lead to heart attacks, heart failure. You can have high blood pressure. So we need to monitor our diet. True. And what's not helping really is the newer shift towards the Western diet, which you've seen with, McDonald's around every corner, Hardee's, KFC. We all love KFC. I love it myself, but it's not fast. It's fast. It's good, but it's not. It's good to eat, but it's not healthy overall.
Exactly.
So what's better is if you look at our society, look at the people up in Hunza. See how their longevity of life is.
True.
They live into their 90s, their 100s, because they eat properly and they are very physical. They are active. They work.
They're going uphill, coming downhill every single day. So, there's a lot of exercise which goes into it as well.
Correct. So there are simple things that you can do. Let's say if you're going to the mall and you're parking at Centaurus, park further away and walk. Yeah. Instead of taking the lift, go ahead and walk up the stairs, walk down the stairs. Do these little simple things to, increase your calorie expenditure, and then try and eat a little bit less, and aim towards more healthier lifestyle. So aim towards like a Mediterranean type of a diet. So that means like olive oil is being used, a lot of salads, vegetables.
Soups.
You can use soups. You can have white meat, so like your chicken, your fish, and that should be baked or grilled, not fried. And then not deep fried, definitely not deep fried. And then the other thing that you need to look at is we can have protein in the form of dal, so like our lentils, everything else. And then one of our major things that we don't realize is the winter. We all love dry fruit around the winter time. Is the better dry fruit to have are walnuts and almonds. So akhrot and badam are much better than cashews. Cashews are particularly high in cholesterol. So those should be tried to be avoided if you can.
Which one was cashew?
Cashew nuts is kaju.
Oh, okay.
Yeah.
All right.
And I love them. And that with the fried ones as
I
well.
know,
And
they're
I
so
just cannot
yummy.
help it. And even with dry fruits, Dr. Saab saying that, you really need to be careful because you can actually have walnuts or almonds. Wow.
So, which actually reminds me that there was this one time, there's an athlete over here on the show, and of course he's discussing his diet and mentioning all the dry fruits, to which we were like, hey, we just eat dry fruits for 5 minutes and we get pimples, and he goes like, you have to burn it off, which is true.
It's true. So you're actually, to burn it off, what we say is, what we recommend from the exercise regimen, it doesn't mean everyone needs to have a gym membership or anything else. It's just a brisk walk. So by a brisk walk, I mean something where you walk and you actually create a sweat. So you're sweating a little bit, and you do it for 30 minutes a day.
Exactly.
So if you're going to start off, I don't want a person who's not exercised forever to go out there and do 30 minutes in one go.
Straight away.
Yeah, get your stamina up there, go 5 minutes one day, 10 minutes the next, and slowly build up to 30 minutes a day. The better option is obviously if you can get to it, jogging is good as well.
Yeah.
And then anything, if you have a stationary bike, if you can't walk, or biking is good as well.
Exactly. So any sort of workout or exercise, ladies and gentlemen, where your calorie expenditure
Physical
actually
activity.
goes up, I think is something which is more than welcome. Or probably you can just play hide and seek with your kids and run around all
That
over your
counts
house as
as
well.
well.
Because I almost do it every single day. And the best part over here is that, my little angel, she does not really know where hiding is. So she'll probably go somewhere, sit behind a table of glass and be like, hey, find me. And I'm like, pretending, where are you, where are you? So it goes on. But so you just mentioned that, that rather than having meat protein, we can probably focus more on lentils as well. And this is something which is very tricky for people like me who go to gym. And because we're really more focused on the amount of protein we really need, to have a better muscle build-up as well. So, for example, going and having barbecues, we're making sure that it's safe, and then grilled fish and things like that are better choices. But what you just referred to as was that rather than having mutton or beef, it's better to have lentils, to fill in your protein for the day as well. Which lentils in particular can you please share? Because I'm very unaware about that. Because every time we talk about protein, it's either mutton or beef.
Okay, so it's mainly any of the dal. So you're just like your typical dal mash, your chane ka dal, that sort of garbanzo beans, as they call it abroad. So a way in which the Mediterraneans use it is they have the falafel.
Oh
But
my God.
you don't want it fried per se.
Yeah.
Use an air fryer. An air fryer is a lot better than the typical frying that we do. So that type of protein is much better. Red beans are good as well.
Yeah.
So any sort of protein from that aspect. Plus,
But why not mutton or beef, and why lentils?
it's because when you look at mutton and beef, you can still have it. So I'm not saying do not have it. Have it, maybe limit it down to about 3 to 4 times a month.
All right.
And you want to avoid your red meat particularly because that is high in your LDL cholesterol, which is your bad cholesterol, which leads more towards heart attacks, strokes, and everything else.
All right.
And you want more of your good cholesterol. And the only way to have good cholesterol is if you're genetically blessed with good cholesterol, which if you're lucky...
Pakistanis are not.
And
Mostly
we're
not.
generally not.
Yeah.
We're generally not. The only other way to get it, there's no medicine to increase your good cholesterol. It's only by exercise.
All right.
So those are the things that you need to watch out for.
Wow,
Right.
that's wonderful. And just in addition to that as well, I thought, that's going to happen, but that didn't happen. So
Oh, sorry, I was just...
moved on as well. Well, now what I want is that obviously, so when, I think everybody over here in my household at least loves mutton and beef and everything as well. And you've kind of spoken about the repercussions it can have on your heart health as well, which is great. But now, so with cholesterol and all of these things, Pakistanis are so unaware whether their cholesterol level is just within the right mark or not. And they do not even get themselves tested. And just very recently, what I've seen is that in people who are very younger than me, kids as old as 17 or 18, there's a spike in triglyceride as well.
Correct.
Which kind of consists of animal fat and vegetable oil. So after doing my research, and then the kids were complaining, oh, we have headaches and whatnot. But all of this winter vacation, they have finally been eating all of that fast food which was available. So how do you think that triglyceride can actually have an impact on your heart health in the first place, or on your overall physical health, and then how to control it?
So triglycerides typically are your fats. So they're the unsaturated fats. So when you look at it, they're common in all your fried fatty foods. You see them in more of your frozen products as well. So when you go and you fry the frozen chicken nuggets or fish, whatever you have, and you particularly, what we typically do here in Pakistan, particularly during Ramadan as well, is I'm pretty sure everyone is guilty of it. You take the same oil that you made your samosas or your pakoras in, and you use it the next day and fry it again in there. And that is double the unsaturated fats in there.
Right.
So you're just taking in extra by day until you... So what you should do is you should throw away that oil and use fresh oil the next time.
Right.
So that's one thing. But for the triglycerides particularly, triglycerides are heavy in red meats and so forth. So you need to watch that. You need to watch your fried fatty foods. And then triglycerides not only affect your heart health, but they lead to, if you have such excessive levels, like if you get into the thousands or even above 500, it can lead to gallstones, so stones within the gallbladder. You can have pancreatic stones. Pancreatitis can be caused by high triglycerides. And the only way to, some medicines don't even work. At times you have to send a patient to have plasmapheresis, where just like dialysis, they take the toxins out of the blood, they actually remove the triglycerides out of your blood. So it is common, you see it often, and what most people don't realize when they come to the physician or go to a primary care doctor, they usually just get the cholesterol checked.
True.
You don't want just your cholesterol, you want your entire lipid panel or lipid profile. So you want your cholesterol, you want your HDL, you want your LDL, and your triglycerides.
Well, this is actually great information because you're right. I mean, a layman actually, whenever we go to the doctor, we want our cholesterol check. But your lipid profile, as Dr. Saab mentioned, is what you should be looking for, especially when you're doubtful you have a heart condition. And now, you know, when you spoke about changing oil, Shahzad, it's such a common habit in Pakistani households, and it's safe to say it happens in every other household. So it's a request for all of you out there, if you're watching, share it with your parents, share it with your friends and everyone, especially
if the parents do it, or save the oil. You know, there's so much excess oil in the curry. You can use it every single day.
No, but imagine, Shahzad,
Don't do
for
that.
the people living with, you know, cardiovascular diseases or similar conditions in a household, you should really be careful for them. Please do not reuse oil. Now, towards
that's not what I'm referring to. What I'm referring to over here is that, you know, so the household where, alhamdulillah, there's nobody with a cardiovascular disease will eventually end up having cardiovascular disease because they've been reusing the oil every single day. And today is the very first time that I've heard it from a professional that, hey, you're not supposed to do that. Which is why it's a practice in UK, US, everywhere. You go to a restaurant, they keep a check whether the restaurants are using the same oil or not, or whether they use the fresh oil every single day. And they do use fresh oil every single day.
And we're just talking about the households in Pakistan. Imagine the restaurants now. I'm questioning everything.
मैं तो 5 लीटर वाला पूरा महीना चला लेती हूँ. वो ऐसे चलता है.
ऐसे नहीं चलाना चाहिए. But towards the end, Dr. Saab, you know, I'm going to take you back to where you started the conversation with. Losing weight and eventually keeping physical activity is definitely going to help you. But when we say that, and when such a sentiment is created, the common notion is lose weight. Patla hona, patla hona. The concept over here, which I want you to clear, is losing weight is not necessarily going skinny, but it has a lot to do with maintaining the BMI and your health.
Correct.
Let us know how we can do that.
So you're absolutely correct. So we don't just go by, there are a lot of people who fall into the category of obese or morbidly obese or just the right BMI. So what we need to look at is when you lose weight, it needs to be a maintained, healthy loss of weight. So the fad diets, the crash diets do not work. So you want to look at it from the perspective that when you're going to lose weight, it has to be something that is maintained. And you want to look at your BMI. So a person who's very tall, they can have a different ideal body weight than a person who is short in stature.
Right.
So not everyone needs to be skinny and thin like your typical, like what you see a movie star or a model. They don't need to be like that. You need to be at your ideal body weight, and you mainly go by BMI. We aim for a BMI ideally of around 25 or 25 to 30 is
I'm
okay.
exactly at 25 these
25
days.
is the better BMI.
I'm under whatever that is.
It's fine.
It's the body mass index, that's what it is, and you know, you just have to weigh yourself and put in some
I
calculations.
did, but it's below what it should be for my age and height.
So it says that, you know, that the fat level in your body is low, and which is fine anyways as well. So, you know, you really do not have to go beyond 30. That's what
Of course,
Dr.
I
said.
wish
Correct.
not.
But now, Dr. Saab, you know, obviously we have this habit of self-analyzing ourselves, you know, every single day since we're getting maturer. We want ourselves to be healthier. You know, someday we will check our pulse if everything's all right. Everybody has got the BP machine at home, and they're all electronic these days. So, you know, you keep a check. Now, how do you think anybody can analyze just by looking at themselves? Because these days, people do complain about palpitations, घबराहट हो रही है, you know, probably difficulty breathing, that too can be related to COVID as well, then anxiety, and then panic attacks. You know, so how do we analyze that? God forbid if any of this condition is prevailing with us, if it happens to us once a week or twice a week, whether it's something wrong with our heart or something wrong with our mind.
Well, I'm glad you brought that up. I mean, practicing in the States for so long, I had never heard of the term apprehension, which is घबराहट यहाँ पे. Everyone comes in and says, मुझे घबराहट हो रही है. And at the beginning, I never really understood what they were trying to say. But I've now caught on with the Pakistani terminology. What they're trying to say is that it's actually just basic anxiety, stress-induced. Others, it's actually more due to an underlying cardiac condition, be it high blood pressure, be it palpitations, they're tachycardic, heart rate's faster than 100, or they're having underlying chest pressure, chest tightness, things of that nature. So those are things that you need to delve out. Now, basically, anxiety and stress can lead to heart conditions. There's more research towards the link between depression and heart disease as opposed to anxiety and heart disease. But we do see, there is one particular aspect that we do see. There's a cardiomyopathy, which means a weakening of the heart muscle, or like congestive heart failure can do at times, where you see it's called stress-induced cardiomyopathy. So when a person automatically has some major stress in their life, loss of a loved one, what is typically called broken heart syndrome. You've probably heard of it. They have loss of a spouse, and automatically they have chest pain, shortness of breath. The heart muscle, the heart arteries spasm down and mimic a heart attack. So there is a link between anxiety and heart disease. It just hasn't been fully researched.
But sir, mimicking a heart attack, does that really entail that it is seriously a heart attack, or it's just...
So it looks like it. It looks like it on an ECG.
All right.
You have the elevation in the blood markers that we look at.
Yeah.
But when you do an angiography, when you do the coronary angio, the arteries are fairly normal. There's no severe blockage anywhere. And the echo or other modalities show you that the pump function is very weak, and it's got this typical presentation. So it's called Takotsubo's cardiomyopathy, which is based from a Japanese word for octopus trap. So it looks like an octopus trap.
So what are we supposed to do then? God forbid, if you're in a condition of such sort.
You should go directly to the hospital. If you're having things like that, you should be directly evaluated in an emergency room. You shouldn't really wait to go see someone in an OPD sort of a basis.
Right, and because at the moment as well, I don't think you can tell for yourself what's going to happen.
Correct.
So even if it is severe or not, even if, God forbid, I mean, even if it's going to be a mimicked one or a real one, I think you definitely need expert's opinion at that moment.
Exactly, and just in addition to that, because we are talking about that, so let's just get that straight as well, because usually what people do is they say that, God forbid if you're in a condition of such sort, because even with panic attacks, people do get confused whether it's a heart attack or not, because the heart's pumping at 170 beats per minute, and you're breathless, and your arms are going numb, so you're always confused, because that's what people say, that these are the preliminary conditions or signs of you getting a heart attack. So what are we supposed to do? Are we supposed to take an Angicid and then go to the hospital straight away?
No, I would not take an Angicid unless you already have known heart disease underlying.
Or you've been prescribed.
Or you've been prescribed it, particularly prescribed it. So don't go and grab like your father or your mother's Angicid from the cupboard and take it. Please don't do that.
Why not? Why not?
Because it can actually drop your blood pressure precipitously.
All right.
And can lead to further catastrophic events if you're not prescribed.
Okay.
So there's certain things that you shouldn't do. I mean, you should, if you're having those palpitations, the tachycardia, the shortness of breath, you should see a medical professional. So go see your primary care physician, see a cardiologist, get evaluated and assessed. There's certain things that we would typically do. We'd probably say get an ECG. We'd want to check your thyroid function, make sure you're not high on your like hyperthyroid or hypothyroid. We'd want to make sure that your blood pressure is in control. We see it typically now in the young who are taking a lot of Red Bull, Sting, these type of high caffeine.
Pre-workouts as well.
Yes, that actually, we see a lot of patients coming in with elevated blood pressure, elevated heart rates due to that excess intake. And that, if you limit that, you limit the smoking as well. People generally are smoking. That raises your blood pressure, raises your heart rate. Those things can contribute to it. But our main thing is you need to be evaluated. I would not don't ever take things lightly. Always be safe rather than be sorry.
And just one last thing, and that is, I'm sorry that I have so many questions related to it, because I think I'm one of those people who really want to look after your hearts, ladies and gentlemen. So very quickly, so a lot of times people, usually my family members, so I'm not going to talk about people, my family members, if they're traveling from UK, they come down to Pakistan, they'll take out these supplement bottles and be like, hey, Khalu, this is very good for your heart, you should use this, this supplement is for people from 30 to 40 years of age, and your heart health is just going to be great. And the bottle even says, good for your heart. Do you think that these supplements will actually have an impact on your heart health? Is it going to make it better?
So that's a very common question we get every day in the clinic. So one of the things is, what I like to explain to patients is that you should be getting your normal vitamins in your regular diet. So everything should be available to you in your diet. The one thing that we lack here in Pakistan is we lack the vitamin D, because we don't go out to the sun, we don't get that. So that's a separate story. But getting like your Centrum Silver, the women's health, the cardiac health, that is really a money-making scam, so to speak. And it's the pharmaceutical industry that has perpetuated that scam.
Of course.
But on the flip aspect of it, you can take it, it's not going to harm you. Anything that's excess in the body, if there's excess of vitamin B, vitamin D, that essentially is going to be excreted from the body in your urine or whatnot. So essentially what I tell patients is you're
harmless.
making expensive pee.
So thank you very much, Dr. Saab, for being with us. Lovely to be in conversation. And thank you very much for giving us an amazing insight on how to kind of look after your heart health. Ladies and gentlemen, we want you to kind of stay healthy, because we have been going through difficult times. We really do not want another surprise for ourselves, because, either we're recovering from COVID or either we're getting the booster. We really do not need to go and see Dr. Saab and be like, hey, you know what, can you please do our echo or ECG and tell us whether our hearts is in a good shape or not. So please make sure that you work out, maintain a healthy diet.